Have you ever thought of starting your own business as a nurse? Well, here we show you how easy it actually is.
I'm Dr. Ethel Andrews. I am an entrepreneur. Believe it or not, nurses can be entrepreneurs. I have got my own company which is registered as Woondoc Pty Ltd. It's amazing because it allows me to use my clinical skills which I have acquired through the years and a bit of corporate experience that I have gained to make a difference. And it allows me to think outside of the normal plain scope for nurses because you can be your own boss, which is always an amazing thing. So for anybody that is wanting to start out, I would say do something that you are passionate about. Find something that you love to do, because when the days are tough and you just feel frustrated, the passion is what's going to carry you through. And then go big, because you only live once, and if you live properly, then that one time is enough, and you have to carry that through in every aspect of your life. So whether it's your work, because even though you are self-employed, you do have a boss, which tends to be a bit harder than having had employment somewhere else, but it's so worth it in the end, like going home and knowing that I'm the boss lady. So the steps for starting your own business is not as daunting as it sounds. Whenever I speak to nurses in the ward, everybody says that they want to come and do what we're doing, but they don't know where to start. So what you have to do, the first thing is focus and decide what it is that you want to do, because we know that as nurses we tend to be jack of all trades, but you have to be the master of something. So if you're wanting to do a wound clinic, do a wound clinic, and if you're wanting to do a well baby clinic, do a well baby clinic. But don't try and incorporate too many things, because then you're not maintaining the speciality that you're wanting to. You need to get the first thing you need to do is get your practice number from the Board of Healthcare Funders, which is the BHF. Thereafter then, you need to then decide where the location is going to be, because you need to offer the service and make sure that it is really necessary. So finding your spot, that I think would be the next thing, and then you need to invest in the equipment and invest in yourself. Continued education, I can't overemphasize, because trends are forever changing. So you need to then keep afloat with what is changing, but you also need to bring the business side of things into it. So there's a Women in Healthcare Society, which I find very, very helpful, because you then learn from other colleagues that are already in business and they've been doing the things, so you don't have to make the mistakes that everybody else has already made. You can benefit from being involved in a group like that. For starting your own business, and I hope the advice that I gave you is helpful, but whatever you do, as daunting as it seems, just keep going, because it gets easier as you go. Everything we do at this practice is evidence-based, because we are a scientific practice. Because of my association with the University of Witwatersrand, it is important that we make sure that our patients benefit from evidence-based care. Something that is very simple, for instance, what cleaning solution should you be using? There's the debate whether you should be using saline or whether you should be using water. But Cochrane reviews are showing that you can use water, provided it is drinkable, to clean the wounds, and you will have the same infection rate as whether you had saline. So the ideal is that you use water that is heated, so that we don't cool down the wound, because as soon as we cool down the wound, it takes about 4 hours for the wound to recover. As part of my portfolio as president of the South African Burn Society, and our aim of wanting to do everything to save patients' lives, a simple thing that patients can, or people can get involved in, is tissue donation, because one tissue donator can actually save 60 lives, which is amazing, because as I said, the number of people that burn in South Africa is astounding, and we just can't keep up. So if your relative or even you yourself becomes a tissue donor, we know that we can then continue to give life long after we have stopped living. So I personally am a tissue donor, and Tuniswa is signing up, and we hope that you would too.